So if you're watching this video, that means that we have a telephone consultation that is scheduled sometime very soon. Wanted to take a moment and give you some information that will be super helpful for you before the consultation begins. So a lot of my patients ask me about, hey, what's going to happen on the day of the infusion? So I wanted to let you know about that. On the day of the infusion, you're going to come into the clinic. We are going to have you fill out some paperwork. Then we're going to get your vital signs. We're going to measure your blood pressure, your heart rate, your oxygen level, and make sure that it's safe to actually begin the infusion. And assuming you are safe and your vital signs are stable, then we will insert an IV, typically in your forearm or your wrist or in your upper arm, so that we can actually give the ketamine. Before and after the infusion, we want you to have a ride to and from the clinic. After the ketamine infusion is completed, it's not safe to drive for 12 hours afterwards. You're definitely going to need a ride back to your house or the hotel you're staying at. The other thing patients ask me a lot about is preparation. At Reset Ketamine, we recommend that you do a 1-week preparation prior to your first infusion and actually throughout the series of infusions. I will send you the preparation guidelines. It's about 12 or 13 recommendations, things that include yoga, meditation, exercise, being in nature, journaling, eating a healthier diet, surrounding yourself with positive people. So I'm going to send you that list as soon as the conversation is over, but just know that you will have to prepare for 1 week prior to your ketamine infusion. So once the telephone consultation is completed, we will get your medical records, typically from your primary medical doctor or your psychiatrist. I will have you fill out a form. It's called the Consent for Medical Information Release. And you're going to fill that paperwork out so that I have your permission to speak with your doctor, talk with your psychiatrist, and get the medical history, whether that includes things like your most recent laboratory tests, your most recent EKG, x-rays, etc., just so that I could have the most amount of information to serve you at the highest level. Some of the side effects our patients will experience are nausea, vomiting, an increase in blood pressure, an increase in heart rate. There might be symptoms of dizziness, lightheadedness, and it's important to communicate to us about this because we have medicines available to actually prevent that or treat you if you develop these side effects. We do want you to fast for 3 hours prior to your infusion. That'll actually prevent any nausea or actually help reduce the chance of you developing nausea. And after the infusion, we also want you to take a break from solid foods for typically 2 hours and just do liquids and just to keep the stomach settled without a lot of heavy foods. As far as long-term side effects, there have not been a lot of studies on patients who are receiving intravenous ketamine. However, there are some studies on people who use ketamine on a recreational daily basis. So these are people who are using high dosages, 1 gram, 2 gram of ketamine per day for multiple days on end. And in that patient group, there has been reports of ketamine-induced cystitis. So that's like a bladder irritation. There have been some reports of liver problems and liver inflammation. So that is some of the things that could happen, especially if someone is using ketamine on a high frequency, high dosage usage. Now, because we're aware of this, we recommend the smallest amount of ketamine possible, and we space it out. That will likely prevent any side effects, but I do want to let you know that that has been reported in some cases. The last thing I wanted to touch upon is pricing. So depending on what condition we're treating, it's going to be different price ranges. Typically for depression, PTSD, anxiety, OCD, that price range is $650 per infusion. We recommend 6 infusions, and at this time, insurance companies do not cover that. For other conditions such as chronic pain, fibromyalgia, trigeminal neuralgia, other forms of neuropathic pain, we actually do a longer infusion with a higher ketamine dose. And so depending on what we're treating specifically, it'll be a different price range, and I'd be happy to talk to you more about that during the telephone conversation. So after watching this video, you're probably going to have a few more comments or other questions. So please write those down, and when we get on the telephone conversation, I'd be more than happy to answer them. Looking forward to serving you and chatting with you very soon. Take care.